All right, we weren't able to complete all of the content from chapter 26, drugs for anticoagulation and drugs that affect the coagulation or the clotting cascade. So I want you to pick up where we left off. I'm making a short video that you can watch at home from Blackboard. And we're going to go back a few slides just because I know near the end of the class you might have been rushed. So really the medications that we're talking about in this chapter are heparin, and that's a very common medication that you may give. Please note that the adverse effects of heparin are abnormal bleeding and thrombocytopenia, and so you would need to know. Quite often, a nursing student might say, "Well, I'm watching out for thrombocytopenia," but that's not going to help you. What's going to help you is recognizing the signs and symptoms that you would assess your client for when they're demonstrating thrombocytopenia. So think to yourself, what would your client complain of, or what would you note differently in your nursing assessment if they were experiencing thrombocytopenia? Bring those types of suggestions to class. Also, if you notice any abnormal bleeding, overt signs and symptoms of bleeding, we would definitely be very concerned about this. And the lab tests, I'm pretty sure that you can look them up. But just to refresh your memory, I hope you can come up with the 2 lab tests that you need when you are administering heparin. Quite often we just use PTT, but you can use PTT and INR. The antidote's there for you, protamine sulfate. Notice that the antidote for heparin is very different from the antidote for warfarin. But before we get to warfarin, let's look at low molecular weight heparins. And the big message here was that these are considered maybe safer. I'm going to use that with caution. The duration of action for low molecular weight heparins is 4 times longer and more stable response is seen. Therefore, there's not as much follow-up, and it doesn't necessarily cause it's less likely to cause thrombocytopenia. So you should know what your thrombocyte levels are in your complete blood cell count. And then let's move over here to warfarin. Oh, actually, before I move on, quite often you will administer Inohep or Lovenox or Deltaparin or whatever the case may be. So you'll want to be familiar with this and maybe make yourself a cue card and keep it with you in case your clinical instructor says, would you like to give a low molecular weight heparin? You'll already know the lab test that you're going to pay attention to. Notice how there aren't any lab tests here. It's a low molecular weight heparin. So basically you're paying attention to these lab tests that we discussed over here. Oh, and if you give too much, you would be reaching for this antidote. Okay, so that's important for you to carry over. It's a safer version of the same medication. Now let's talk about Coumadin, also known as warfarin. You already know which one's considered the generic name and the brand name based on the first letter of each drug name. The primary use is to prevent blood clots, and for clients that are typically going to be on this medication for a long term. Maybe clients that have had a valve replacement or a mechanical valve or had some sort of I'm trying to think, risk of a blood clot somewhere that they would be on oral anticoagulants for quite a long time. Now, keep in mind, oral anticoagulants are helpful in preventing clots, but if the client were ever to cut themselves or be in a car accident, this could be very dangerous for the client as well. The lab tests that we're paying attention to are different with this medication. We're paying attention to, I'm hoping you said, INR. And again, this medication will not affect any or any vital signs. So it does not affect respirations, blood pressure, or heart rate. It shouldn't affect any of those things unless there's a complication. So we don't anticipate you need to assess these things in the sense that if you notice a client has tachycardia and hypotension, those 2 things together would indicate potentially that your client is experiencing a hemorrhage. If your client is tachycardic, meaning a heart rate greater than 100, or hypotensive, meaning your blood pressure is less than 110 or 100 and they're symptomatic, then you would be very worried that your client might be bleeding internally somewhere. There are other signs and symptoms of bleeding internally, and you can refer to your textbook for that. But notice what we do have in red here. Abnormal bleeding is definitely an adverse effect, and we never, ever, 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 ever give this medication to someone who is pregnant. And you can already imagine what category or classic pregnancy category this medication would have because it causes abnormalities in the fetus. I hope you're able to identify what category that would cause. So moving forward, warfarin and Coumadin are an oral anticoagulant. It's the preferred drug of choice when you're considering anticoagulation long-term. And it's very quite common. We know it well. We're paying attention to the INR, or the International Normalized Ratio. Unfortunately, warfarin has a narrow therapeutic range, so it does require clients to go and have their blood work checked frequently. So very important that clients verbalize a willingness and an ability to drive to their appointments and for follow-up. There will be times when clients will tell you, oh, I feel fine. Why do I need to keep getting my blood checked? And you'll have to provide that information to them. Can you imagine that if we weren't checking their blood, what could happen if if their INR slowly increase gradually over time? What might happen to the client? I hope you can. Also, very important for you to note, and your textbook does a great job of spelling it out, that there are a lot of herbal remedy interactions, such as garlic, that interfere with warfarin, and lots of other common over-the-counter medications that interact with warfarin, such as Tylenol. Patients need to be educated about a certain vitamin in their diet, and you need to know what that education would require. So I challenge you to go find out health teaching. And if you want to find out, maybe you can just look up things like my doctor prescribed or put me on warfarin. What's everything I need to know about it? And green leafy vegetables, there's something important about green leafy vegetables. I can't remember what it is. No, I'm kidding. Of course I can remember what it is. And I'm hoping that you know what it is too. All right, so there will be times when your clients may be on both heparin or low molecular weight heparin and warfarin. There's a reason for this, and your textbook does a great job of spelling it out. So please make it special note as to why they might be on both, but recognize that while they are on both, while they are consuming both medications, they're at a greater risk for bleeding. And it's very important for you to tell your clients that, and if they ever did bleed, that they would need to apply pressure. And if they noticed any bleeding that wasn't stopping within a certain time frame, they would need to seek medical evaluation. All right. The antidote for warfarin is vitamin K, very different from heparin. So teach clients not to increase or decrease the amount of vitamin K in their diet. Vitamin K, there's great sources of vitamin K in green leafy vegetables such as kale, spinach, broccoli, and Brussels sprouts. All right. So look a little bit into vitamin K. Oral anticoagulants are contraindicated with clients who have a hypersensitivity. Well, what's another word for hypersensitivity? I'm certainly hoping that you said allergy, because allergy is a big word, or is just a simple word for hypersensitivity. So clearly we're not going to give our medication to a client who is allergic. You would know that, they would know that.